And the independent commission looking into what went wrong when COVID swept through long-term care homes say they were forgotten by the government. Even though its report isn't due until April, it released early recommendations today saying immediate change is necessary to prevent more vulnerable residents from dying. It has grieving relatives wondering if their loved ones could have been spared.
The fact that they were so unprepared, I still can't believe it. I had to go on Facebook and put out a request for face shields. Why couldn't they have done that?
Hey, how are you? I'm really glad to see you today.
I'm glad to see you, honey.
Kim Beauchesne would go and see her father through the window of his long-term care home after visitors were no longer allowed inside. He died of COVID in April at the age of 94. She believes her father's death could have been prevented if the long-term care home had been properly prepared.
They were still all eating together at a dining room long after we were locked out. So he passed away on the 9th and he was positive 4 days before that. But they were all still together, and I believe staff were still coming and going. So yeah, definitely it's mistakes, human mistakes that cause that, 100%.
55% of Ontario's long-term care homes have had COVID outbreaks, and close to 2,000 vulnerable residents have died. Since late July, the Commission has spoken to more than 200 witnesses who detailed a lack of preparation that led to the pandemic sweeping through homes. Some used words like devastating, trapped, and terror awakened. In a damning statement, the Commission says it has heard long-term care homes were forgotten in the initial provincial plans to control the spread of COVID-19 until residents started dying. The Premier insists the government is doing everything it can.
It's the #1 priority to take care of the most vulnerable people in society. We've inherited a broken system.
The Commission's recommendations include improved testing, infection control, and inspections, and increased staffing with a minimum daily average of 4 hours a day of direct care per resident. That's up from the minutes the union says PSWs have to spend daily now.
We have not stopped on long-term care, making sure that we get as many PSWs as possible.
Has the government done enough right now to deal with what's happening right now?
No, they haven't. And in some cases, we're actually in a worse position than we were before. And that's very bad news.
How so?
Our staff who have been working for 6-7 months, are exhausted and traumatized.
The Ford government has given a temporary $3 an hour raise to PSWs and is promising $540 million to hire and train more staff. But that was only announced 3 weeks ago. In contrast, Quebec started a mass hiring and training blitz in June.
How could I go without seeing you every day?
During her father's final days, Kim could tell staff were disappearing. They too were getting sick.
And I could see through the window he tried to have a drink, but he was unable to lift the cup because of a bit of a fever. His hands were shaking. So when you watch that day in and day out, it's definitely anger. But I think the government let them down massively. And it has to change. It has to change.
There are currently 77 long-term care homes. An outbreak in long-term care. That number has quadrupled since the start of September.